Hi, my name is Dr. Kara Davey. I'm a clinical psychologist and the founder of Kara Clinical Psychologist in Sussex and Dr. Davey Coaching. I spent a long time working in NHS services and specifically in trauma services. Now, whilst in an NHS trauma service for many years, I experienced years of difficult fertility journey. I had 5 early miscarriages and missed miscarriages, and also lost my daughter Jessica, who was born sleeping at 33 weeks. I now support other parents in any way I can, other bereaved parents. So first of all, I'm sorry that you're here and that you're watching this and that you too know the heartbreak of losing a baby or babies. So I want to talk to you today about valuing your voice and having the confidence to speak up after pregnancy loss. So this is a topic that I think is often neglected, and I'm really pleased to see that Mayahs Legacy is talking about this. So lots of people are aware that obviously after losing your baby you will be grieving, but what people don't think about is all the other layers and all the other hidden things that are difficult for people. So in terms of kind of thinking about valuing your voice, who might you need to be able to speak up with? So firstly, my experience is that family and friends often often you will have some family and friends who get it, and others who really don't, who perhaps avoid speaking to you, who try to shimmer you on and kind of cheerlead you to get better quickly, or to see the bright side of things, or to be happy, or to get over it, and whilst minimalizing and completely not understanding that that's just not how it is when you lose your baby or babies. There are lots of people who don't know to say your baby's name, to remember them, that that for most bereaved parents, that's a really lovely thing to be thought of, rather than something that is difficult and to be avoided. Lots of family and friends don't think about potential triggers, so they might happily come and meet you with their children without realizing that actually it's really hard for a lot of bereaved parents to see pregnant women or children after loss. So you might need to speak up with kind of family and friends to help them understand what you need, what you don't need, and just to understand how to best support you. There's also the kind of culture. We might need to speak up against this kind of culture of stay strong. And non-birthing partners, men specifically, often talk to me about this, that people kind of say, oh, how's your wife doing? Or, are you staying strong for her? Or, they feel internally that they need to be supportive of the female partner, which of course we'd want both partners to be supportive of each other. But as a non-birthing partner, or as a man in the relationship, it is totally okay to not feel strong, or to need to advocate for what you want and need, and to feel that emotion too. There's a theory called the circle of security, and within this theory, it talks about when bereaved parents should be kind of the center of that circle, and all the layers of support outside. Everyone should support inwards, so the bereaved parents don't need to support other people. It's okay for them in that moment to be distressed and to just be able to think about their own needs, and as you go outside of that, it might be, say, the grandparents and other people outside the circle might support the grandparents because they've also had a loss, but again, it isn't the bereaved parents' job to support inwards, to support outwards. So the circles of security is about, okay, how can we best support bereaved parents, and ensure that those who also need supporting within the network are getting adequate support too. So we might need to speak up if people are expecting us to, unfairly expecting us to be able to support at a time when we can't. We might need to be able to speak up for ourselves within the workplace. So, in terms of when you return to work, how you return to work, whether you go back as a graded return, whether you need workload reduced, how you're feeling within the workplace. If you work with children, it might be that actually there are certain age groups that are difficult, and you might need to work with different ages. Or, if you're a teacher, maybe you don't teach straight away. Maybe there's a period of, observing or doing some other tasks within the school, or, depending on what your job is, it might be that reasonable adjustments can be made to make that easier. And this is a transition. So I think sometimes employers can not recognize this isn't forever. If somebody asks for different circumstances, that's to help them to transition back and to help them at that point when things are difficult. It doesn't mean it's like that forever. It might be that you need to educate or, kind of speak up or advocate for yourself in terms of how you're feeling in the workplace. Again, other people might not understand that. And again, there can be a gender difference here in terms of the non-birthing partner has to go back to, will often have to go back to work. So for those who don't know, how it works is if your baby is born breathing, or after 26 weeks, then for a woman, they're entitled to the full year's maternity leave. But actually a non-birthing partner or a father is not. They'll only get the standard kind of paternity leave from an employer or what that employer offers. So that could be, a couple of weeks, a month, a substantially shorter amount of time. And actually it's okay for partners and men to speak up and say, actually, that's not enough and I'm grieving and I need longer than that. And some people use sick leave or annual leave to kind of, as well as bereavement leave. But yeah, speak to your employer about the options there, and it is totally okay to speak up for yourself and advocate if you need to there. Sometimes people return to work too quickly and then end up being signed back off and going back off because actually it's really hard to meet the demands of a workplace. So it's okay to think about it before you transition back, because that's, sometimes easier than going back off. So you might also need to think about how to value your voice and speak up in terms of the relationship. So within a loving relationship, you are very often going to find that two people have opposing kind of needs when they're grieving. So one person might want to talk about the baby all the time, for example. The other person might be quieter and not want to talk about it. One might want to do lots of fundraising. The other might, kind of want to keep it quiet. One might want lots of people at the funeral. One might not. And there might be kind of differing ways of coping with it. And actually that can be quite conflicting because, one parent might feel like, actually, I haven't had the space to grieve in the way I wanted to because the other person, was grieving, in the opposite way. And that was difficult for me. It might be there's, opposing coping strategies. So yeah, for one person, they might, become very insular and not want to talk, or, might use alcohol. Another partner might be, talking about things a lot or going out a lot, or there are different ways of coping, and actually that can put pressure on a relationship. And the easiest way to try and make sense of that is through communication. To get through that as a couple is to go between, okay, what do you need, what do I need, how do we meet in the middle, how do we find a way? If there's been negligence, it might be that one part of the couple want to pursue legal action and one doesn't. So how are you going to negotiate that together? Is it that one is supportive of the other but says, I can't go to court, or I can't do the paperwork, or there's ways of finding that kind of compromise. So you might need to find your voice even within the relationship, as well as kind of outside of it. Another place that people talk to me about kind of needing to find their voice or advocate is with professionals. So whether that be, as I said, in the case of negligence, it could be solicitors, it could be through the courts if it goes through the court, it could be in terms of medical professionals, kind of the hospital, if you're going back for hospital visits, or to get the results of a post-mortem if you had a post-mortem, etc. It might be just advocating what you need from the hospital. It might be getting yourself the right support in terms of counselling or therapy, or it might be just being able to advocate where people kind of, lots of people say grief is normal and therefore, you don't need any support with it in terms of kind of therapy or, from NHS kind of free services. And yes, grieving is normal. It is normal to feel distress. It is normal to struggle more with anxiety, or all of those things are normal, but it doesn't mean you can't be supported with them kind of through counselling, or if there is an element of trauma, actually having a specific trauma therapy like cognitive behavioural therapy or EMDR is just so good for processing the trauma, and you can notice a massive reduction in any symptoms that are actually related to the trauma element. Whilst it won't take the grief away, you know, a traumatic loss, the trauma can keep the grief very stuck, and can keep the emotions feeling much more live, and raw and exaggerated. And I think sometimes if services don't see you to assess you, they don't know whether that is normal grief that you're experiencing or whether there's actually trauma exacerbating that and making the feelings of grief, you know, rawer for longer than perhaps it might be if you didn't have that trauma there. So yeah, it might be you need to advocate for yourself in terms of what services you need or what support you need, and whether to get that via the hospital, via the NHS, privately through work insurance, through a charity. You know, there's lots of options where you might need to kind of advocate for that support. And then also there's, you know, lots of people won't understand that there might be other layers of distress. So, you know, once you've lost your baby or babies, of course you're grieving, of course things are difficult. But alongside that, if you've had early kind of childhood trauma, if you've had lots of experiences of being made to feel not good enough or not adequate, or, you know, kind of you haven't been encouraged to speak up for your needs, or if you've had other losses, if you've had a difficult fertility journey, you know, there might be other things in your life history that actually now become more obvious, more prominent, make it more difficult. You know, lots of people come to me saying that, you know, they were kind of, you know, people who would never really speak up, who, you know, were quite perfectionistic and, you know, perhaps suffer with imposter syndrome, and have always just kind of kept quiet and you know, kind of trusted that other people know better, or that, you know, they shouldn't speak up, or and actually the experience of having losing your baby or babies can be the one thing that really make people realize, actually, now instead of just people pleasing and, you know, kind of making sure other people are happy, I need to speak up for what I need, or it won't ever happen. No one will know what I need, and they won't you know, they won't do that for me, and they can't read my mind. But also lots of people who work through the process of trauma say to me that, you know, further down the line, this isn't kind of at the beginning, but once people have built a life around their grief and not got over it, because we don't get over it, but once people have built a life around that grief, and they're started to kind of you know, move forward a little bit alongside the grief, they can talk about almost a kind of experience where suddenly they value relationships in their life much more. So those who did stick by them, those who did, you know, be willing to listen and empathize and try and understand how they feel, suddenly, you know, they become really important. Lots of people value, you know, they reevaluate their life and say, what's important to me? What do I need to do? What makes me happy? Actually, do I want to work these really long hours that I've been working? Like, is that the focus? Or actually now, do I want a better life, work-life balance? You know, do I want to speak up? Do I want to leave this employer because they haven't been supportive, and find an employer that really values kind of work well-being, so that I can, you know, kind of find that balance I need? And lots of people look for, what are the things that bring me meaning and connection in my life, and how can I bring that in more? And actually, can this be the gift that, you know, my baby or babies has brought to me, that over the process of, you know, having to cope with their loss and coming to terms with the loss and build a life around it, actually, can they give me the gift of, you know, being able to think about what I need, know my own needs, advocate and speak up for those needs. And that's not easy to do. As I say, sometimes people use therapy with me over time, after the initial kind of talking about the loss and processing trauma, if they need to do that. You know, for you know, the other thing I haven't spoken about actually is is for some people, obviously, they will go on to try and conceive again after loss. And again, that's a time where you might need your voice in terms of, okay, what do I need from health professionals, because this pregnancy is different. And yeah, the anxiety is different, what you need is different, the circumstances different, and being able to advocate for that is really important. So for lots of people, the process of therapy can be firstly supporting in that grief, and helping them to feel understood, supported, to know what they're going through, to process that trauma if it's helpful, thinking about supporting them in a future pregnancy if that's that relevant. And then lots of people move on to, just generally finding that meaning in life, and how can I speak up, and how can I advocate, and how can I take away the added distress that's being caused by the people in my life who aren't getting it, or aren't considering what I need or how I feel, and how can I learn the skills to speak up and advocate for myself. And I think it starts with that getting to know yourself better. So for lots of people, you've got to be aware, first of all, of what your needs are and why you're perhaps not speaking up or not advocating for them. So, in lots of cases of negligence, people don't know. We don't know what we don't know. It's very easy to look back in hindsight and say, I wish I'd have spoken up, or I wish I'd have, kind of pushed something more. If you've gone into a service, for example, into a hospital, for example, with reduced movements, and someone's said to you, oh no, don't worry, it's fine. We've listened to the baby's heartbeat, they're okay. And you're, kind of dismissed and you walk away. And actually your baby sadly does pass away. Like, of course, you're going to look back at that and say, oh, I wish I'd have pushed harder, and, I wish I'd have spoken up for myself. That doesn't mean you did anything wrong. Like, in hindsight, that health professional, didn't get it right, or at that point, they weren't able to see that difficulty, but you didn't know to keep going back if nobody told you to, or you didn't know to go in sooner, or you didn't know that the baby was kicking the placenta, or you didn't know to have to really push for that. Whereas I think for lots of people, they then recognize, kind of going forward, well, now I'm going to consider more of the options. I'm going to think about what I don't know. I'm going to think about how to tune into that gut feeling more. So, in that kind of pregnancy after loss, lots of people say, if there's any inkling that there might be reduced movements, or a change in how I'm feeling, I'm absolutely going to go in and I'm going to tell them what, I'm going to speak to the consultant, and I'm going to tell them what's triggering or what's difficult for me, or, what I need in this pregnancy. And that's just not something that might have come into your head before. And as I say, that's not your fault, but it might be that through the process of kind of therapy and support, you're helped to think about, okay, what skills do I need? And as I say, the first one is recognizing, this is something that perhaps isn't a skill I'm as advanced in. Is it because I'm not recognizing what I'm needing? Is it because I struggle with the communication skills and getting the words out and saying the right thing? Is it because I feel that someone else must know better, and I actually lack the trust in myself, or the ability to kind of think, actually I might know better, or I might understand my body and what's going on with the baby better than the medical professionals. We're naturally taught to think that the professionals would know best, but actually sometimes the professionals know best with the information from us. It might also be, in terms of voicing your concerns, one of the other things I see is people who perhaps English isn't their first language, or there's a communication barrier for some reason, whether that be through difficulties with hearing, or anything that could cause a language barrier could also be a barrier to getting the right care, or the care that you need, and can cause you to need to kind of advocate and voice for yourself more. So there's lots and lots of situations after loss where one might need to speak up and advocate for themselves, and to kind of hear and find their own voice. Okay, so what things might help? So we've established why you might need to speak up, and why you might need to find your voice, but just briefly, a few things that might be helpful with that. So the first thing I'd really recommend is planning. So if you're going to a hospital appointment, and you're going to speak to a consultant, for example, you might want to plan in advance, what are the things that I want to talk about? What are the things that I need to know? What are the questions I need to ask? What do I need to talk through? You don't need to go with all the answers, but planning through what are the things that are really important for me to say, because the chances are your mind's going to go blank when you get into that situation and emotions are high. So plan and make some notes for yourself so you know that you're covering the things that are important. Perhaps talk it through with somebody else, whether that is in counselling and therapy, whether it's with a friend or a family member. Talk through your concerns or how it might be, and see if they've got any ideas, or if naturally just things come to you as you're kind of talking it through. As I've said, don't be afraid to ask questions. Speak to others, so other bereaved parents who might be in a similar situation. How might they do it? Speak to, again, partners or other people who might be able to kind of help you to think about the questions you need to ask or the things that you need going forward. Another one, and this might sound a bit trivial, and I want to be careful here that I think it's really important. So one of the things that I talk to people about is we've got a window of tolerance. Everybody has a window of tolerance. So imagine our emotions are in here. They fluctuate kind of in the middle of that window of tolerance. Now, once you experience a trauma or you're going through grief, that window of tolerance, how much emotion we can tolerate narrows. So we are naturally more likely to become irritable quickly, or to anger quickly, or to experience anxiety quickly. And that is a biological kind of response. It's your brain trying to keep you safe. And we can't help that. And it can be widened through trauma work, and it will be widened kind of over time. But, so naturally we, any emotions inside that line feel okay. And as I said, it narrows when we've experienced kind of trauma or difficult life events. So we've got a smaller kind of window of tolerance. Now, if you are thinking about going into a meeting for your baby, or asking questions, or going back to the hospital, to think about trying again, or any of those things, naturally your anxiety is going to be high anyway. So you're very likely to be very close to or already outside of what we call that window of tolerance, where you're experiencing anger, anxiety, tearfulness, etc. So one of the things is thinking about what strategies can you use, like breathing strategies, visualization strategies, what coping strategies can you use to get yourself back in that window of tolerance, or to stay in that window of tolerance. So if you recognize that you're kind of near the edge, are there things you can do with breathing, meditation? And if you want to know more about this, feel free to kind of contact me, and I'll share more kind of more of those strategies with you. But any strategies that you found calming, it could be listening to a piece of music you find calming, it could be kind of dancing if that's something that makes you happy, anything that, visualizing being on a beach or somewhere calm, anything that brings that emotion down a little bit, and recognizing that when you need to, if you're in that hospital setting or a work situation or with friends, and you're starting to go outside of that window of tolerance and it's fluctuated back up, it's okay to take a minute. Like, say you need to go and get a drink, say you need to go to the toilet, excuse yourself, take some deep breaths, go and kind of bring yourself back in that window of tolerance. So as much as you can, how can you think about before what might you need if you're feeling kind of emotionally overwhelmed, and what might help you to stay in that window of tolerance. Is it that you and your partner need to kind of communicate to each other that when things are difficult, so that they can take over talking and give you a minute? Do they need to give you a hug? What is it you need to stay, and I don't mean stay calm as in you shouldn't cry, you shouldn't find it difficult. Of course these things, can be difficult, but what will help you to get your message across in the way that you most need to find your voice? Because it's very hard to find our voice if we're, outside that window of tolerance. All of us just lose it. And that's very often when people are kind of people pleasing or perfectionistic, actually what they're trying to do is manage the anxiety because it's gone outside that window of tolerance. Another thing that can help with that is practicing it in advance. So, kind of playing over in your head, what do I think, speaking to my employer or my friend might be like, kind of talking it through. Okay, how do I imagine it? What if they said that? How would I respond to that? How would I feel? Like, kind of practicing it through and visualizing it in your head can be a really helpful way of, and I don't mean ruminating, going again and again and again in a way that's kind of unhelpful. Like sometimes there is a point at which we want to let that go and stop practicing. But yeah, it can be helpful to practice and just think through, okay, what do I need? And it can help you think about, oh, I need to take pen and paper, or yes, I want to take this stress ball because I know that will help if I'm feeling stressed. Or, it might be that you want to, I've got my daughter's fingerprint on a necklace, for me, sometimes I might, kind of hold that, or, that might help to calm me or kind of give me strength, for example. So lots of people use, jewelry or, as another way of calming. So think through, what might you need and what might help you in being able to voice yourself. And the other thing is kind of encouraging or cheerleading yourself, that it might be saying things like, I know I find this difficult. I know it's hard for me to speak up, but I'm doing this for my baby, or, this is really important, or I deserve this, or I need this, or, finding ways to, we can all have very strong kind of self-critics and critical voices in our head. Are there things that you can do that actually, flip that around, that tell yourself, I can do this and it is okay? And, write down the things that you've achieved, the times where you have managed to, speak up in your life, and, what's enabled you to speak up at those points, like what was helpful then and how can you use those skills now? So yeah, sometimes reviewing the past helps us recognize kind of skills moving forward. So there's just a few ideas there. But yeah, please do contact me if I can help further in terms of thinking about strategies that might support. I have got a YouTube channel that's just the company name, Kara Clinical Psychologist in Sussex. There's a few kind of Q&A questions on there, and I will be uploading more videos, including kind of coping strategies on there. There is, I know lots of people avoid Facebook, whilst grieving, but there is a Facebook site called Emotional Health Toolkit. It's designed by psychologists. I think there were hundreds of us who input into it kind of over lockdown. And if you go into there and go into the guide section, it's all split into anxiety, low mood, perinatal difficulties, grief, loss, like all different topics. And you can find lots of different kind of coping strategies, videos and handouts and things that might help if you need support with kind of different areas. So that's, a completely free resource. And yeah, if you contact me, I run monthly free support groups. So you're very welcome to come along to the free support groups and ask questions or kind of talk to me about things there. Or to find out about any of the other services I offer, please do go to my website. But once again, I'm so sorry for your loss, and and I'm sorry that it's a time where you have to find the strength to advocate and to speak up for yourself. But yeah, if you need support with that, I'm here. And over time, for many people, as I say, it does feel like the gift that your little one has given you, that actually you learn to advocate, you learn to recognize your own needs and speak up, and to do it, beautifully in their memory. Thank you for listening. Bye.